there is any change in language of the question or किसी option को add करने, some option is to be added, so please do not hesitate to write it in the comments. It's a very interactive session. Secondly, as usual, always pathology is a subject जो ना हमारी नैया पार करा देता है. I am saying so because majority of the students get stuck at a score of between 135 to 149. Sometimes some subject is tougher, obs tough होता है, sometimes PSM is tougher, sometimes optha is tougher, but pathology is always a subject which makes you cross that 150 benchmark. Firstly, secondly, as usual, जैसा हमेशा pathology में होता था, we get approximate, we have in this paper also gotten approximately 20 to 22 questions of pathology. I have about 17-18 of them with me. Now, before we even start with the pathology recall, bache, overall the paper was on the moderate side, in the sense that the number of longer questions, number of 3 to 4 liners were slightly more in this paper, making it slightly tricky. So let us start with our pathology questions, starting with the first one, that is, which syndrome is associated with mutation in FBN1 gene. देखो, you very well know FBN1, protein abnormality fibrillin, protein that is fibrillin 1 gene mutation, chromosome 15, associated with Marfan syndrome. Marfan, chromosome 15, FBN1, fibrillin 1. We had a 2-hour recall session of the high yield crash course session of pathology, out of which 12 questions were asked in this paper. So the high yield questions, the high yield crash course recall sessions, they are extremely important. Majority of the topics that are repeated are from PYQs only, so with respect to path we were set. Next question was, you had a history of a newborn child who presented to the OPD with a single palmar crease. Which of the following is most likely associated with this condition? I am sure you know most common genetic cause of mental retardation with abundant neck skin, increased nuchal fold thickness, single transverse simian crease, congenital heart defects, stenosis, hypotonia. This image was not given, but the minute a single palmar crease is there, it is a case of Down syndrome, that is trisomy 21. Next question. Always we get a question from this subtopic also, necrosis, apoptosis, gel electrophoresis, pro-apoptotic, anti-apoptotic genes. You very well know any gene with L in it, that is BCL2, BCLXL, MCL1, any protein with L in it is anti-apoptotic in nature. It is anti-apoptotic. We know this. What is the only exception to this? BCLXS, which is pro-apoptotic. So इसमें क्या बचा? BAX, which is pro-apoptotic. BAX, L नहीं था ना. BCL2, BCLXL, MCL1, flip, all these are anti-apoptotic in nature. All these are anti-apoptotic. Next question. There was a slightly longer question. I do not have the exact language of this question with me, but it was a slightly longer question in which a history of a child with palpebral fissures and upward slanting of the head was given. Main point in the question was it was associated with chromosome 5p deletion. This was the main point. देखो, अब जैसे ही chromosome 5p deletion दिया हुआ है पेपर में, of course it cannot be a case of Prader-Willi or Angelman syndrome. Prader-Willi or Angelman syndrome, but these are conditions associated with genomic imprinting. It is not Turner's. Turner's is 45XO. So what is left? Cry-to-Chart syndrome. Chromosome 5p deletion, Cry-to-Chart syndrome. Next question. Again, a question that was asked with respect to primary hemostatic plug formation. Primary hemostatic plug, it has 3 main steps, that is platelet adhesion. There are 3 steps in primary hemostatic plug, that is platelet adhesion, recruitment of platelets and release of granules, followed by platelet aggregation. These are the 3 main steps of primary hemostatic plug. Platelet adhesion is mediated by GP1B versus platelet aggregation, that is by GP2B3A. So which are the diseases associated? Defect in platelet adhesion, which is Bernard-Sollier syndrome. This is BSS. This is Bernard-Sollier syndrome versus defect in GP2B3A, that is called as Glanzmann's thromboasthenia. So the answer was 1. That is GP1B9 Bernard-Sollier syndrome, which is a defect in platelet adhesion. This is important even for the prospective batches also. These questions, these topics with respect to pathology, but it was a very well balanced paper. You had questions from majority of the topics which were asked. इस बार kidney नहीं पूछा गया था. Any of you who can tell me, मतलब kidney was not asked much this time. As far as I know, we usually get a question from MCD, minimal change disease, MCD, PSGN or something, but it was not asked this time. Next question. Next question. Young child presented to OPD with joint swelling in the knees after fall while playing football. PT is normal, PTTK is elevated. So this was a question that is asking you about isolated elevation of PTTK. When we talk of isolated elevation of PTTK, two main diseases come to our mind. That is hemophilia and von Willebrand disease. Both of these are associated with isolated elevation of PTTK. Now this was a history, history was given of joint swelling. That means patient को hemarthrosis हो रहा है. Joint swelling means he is having hemarthrosis. That is, it is a case of hemophilia. Von Willebrand disease में तो PTK and purpura होता है ना. It has small spots on the extremities. It does not present with knee swelling. Knee swelling is a feature of hemophilia. Of course, iron deficiency anemia, nutritional anemias, and platelet function disorders were not even in the differential diagnosis list. Next question. Next question. Just give me a sec. Okay. So again, a standard one, that is Barrett's esophagus. It is which metaplasia? This was, I think, FMG to mid-year 2022 PYQ also. It is an example of intestinal metaplasia. Please note, we do not call it as columnar metaplasia. It is intestinal metaplasia. The word before metaplasia is the end lining. Matlab, the normal stratified squamous, is getting converted to columnar plus goblet cells. Isko please note, this was the same set of options that was asked in FMG PYQ only. I sincerely hope you did not mark it as option A, that is squamous to columnar. No, it was squamous to intestinal columnar, because along with columnar it has goblet cells also, making it as intestinal metaplasia, that is Barrett's esophagus. Next question. Next question. Hypersensitivity pe tha, mismatched blood transfusion. Acha, tell me this, suppose I am B blood group. I will have which antibody in me? I have anti-A antibody. So if you give me A blood group, it will be antibody mediated hypersensitivity, that is type 2 hypersensitivity. Any disease in which there is presence of an antibody is called as antibody mediated hypersensitivity, that is type 2. So mismatched blood transfusion. Last time FMG paper asked you a question with respect to immune mediated hemolysis. Is which hypersensitivity? Type 2. Antibody mediated hypersensitivity tha na, immune mediated hemolysis was also type 2. Similarly, mismatched blood transfusion, antibody mediated hypersensitivity, type 2. Next question. Next one. A young male presented to OPD with poor beard growth, chest hair, female type, along with atrophic testis, long arms and legs. He is academically below average. Academically below average, that means IQ is also low. So he is a male with female type sexual characteristics. There's poor beard growth, atrophic testis, long arms and legs with unicoid body habitus. The image was not there. Last time's FMG PYQ was a couple is trying to conceive for the past 5 years. On examination, the female is normal, but the male has similar features. It was a case of Klinefelter syndrome. It was a case of Klinefelter's, that is 47XXY. Again, the options were tricky. I hope you did not mark it as 47XYY. No, 47XXY, that is Klinefelter syndrome. Klinefelter syndrome. Next question. KF ring. KF ring, Wilson's disease, ATP7B gene mutation present on chromosome 13, Wilson's. Again, chromosome 13 was a recent PYQ. Then ATP7A gene mutation, Menkes disease was a recent PYQ. KF ring, case of Fleischer ring, in which there is copper deposition in Descemet's membrane in limbus of cornea. That is Wilson's disease. That is Wilson's. Next question. Next question. A young child presented to OPD with hyperpigmentation around the lips along with the presence of multiple polyps. There is hyperpigmentation around the lips along with multiple polyps. Diagnosis: Peutz-Jeghers syndrome. The classical history of Peutz-Jeghers syndrome, PJ, Peutz-Jeghers, कहाँ पर polyps हो रहे हैं? They occur in jejunum. The classical history is presence of jejunal polyps with hyperpigmentation around the oral cavity, nasal mucosa, palms, soles, perianal and periscrotal region. That is Peutz-Jeghers syndrome associated with STK11 gene mutation. Associated with STK11 gene mutation. Peutz-Jeghers syndrome. Next question. Burkitt's lymphoma. Burkitt's lymphoma, this was an image-based PYQ also, in which the starry sky appearance was asked from you in recent FMG exam. So this time they asked you the translocation associated Burkitt's lymphoma, translocation 814. Translocation 922, again a PYQ, translocation 922 is seen in CML. 1114, it is the one associated with mantle cell lymphoma versus 1517. This is the best type of AML, that is AML M3, acute promyelocytic leukemias. Translocations, fixatives, stains पे आपकी बार question नहीं था. I think apple green birefringence. एक बार please tell me, this also was apple green birefringence asked, because I had a talk with few students. Some told me हाँ sir apple green birefringence amyloidosis पे question था, others said no. But fixative pap smear was a question. We'll see that. Next question was, a smear from a lesion shows the presence of multinucleated giant cells. That is, it's a Zank smear. So it shows the presence of giant cells which have multiple nuclei associated with herpes simplex virus, HSV. Straightforward. I'm again saying this. Pathology questions, pathology हमेशा अपनी नैया पार कराने वाला है. Pathology questions are usually simple and straightforward. Next question. Isme please do not go with the image on this. Image was with the previous one, not this. We have a history of a smoker who once works in a cement factory and is now suffering from mesothelioma. Mesothelioma, but it's a very rare malignancy. It is associated with asbestosis. Mesothelioma is associated with asbestosis. You know this well. Cement industry is associated with both silicosis and asbestosis, but the minute the examiner gives you a history of mesothelioma, it's a very rare malignancy. It's very rare, so it will have an association. किसके साथ associated है? Asbestosis. इसमें for the subsequent patches, there are two malignancies associated with asbestosis. That is adenocarcinoma lung and mesothelioma. The most common malignancy with asbestosis being adenocarcinoma lung, most specific being mesothelioma. So जैसे ही mesothelioma की history दी है, the answer to be marked was asbestosis. Next question. Now CLL is something, CD markers associated with CLL. CLL, बच्चे, you very well know that peripheral smear of CLL shows the presence of smudge cells. You know this. So I'm actually not aware whether peripheral smear examination was given in this. Girls know smudging well. वो mascara या काजल फैल जाता है ना, that is it gets smudged. So smudge cells are a feature of CLL. It's a B cell lymphoma. So कौन से markers हैं? It is CD9. B cell है तो 19 तो हो गई. It is CD5 positive, 23 positive. So the minute we have a history of CD5, 23 and CD19 positive, it becomes a case of CLL. Follicular, देखो, तीन main lymphomas जो हमें पता होने चाहिए. The B cell lymphomas, I usually make this table, that is CLL, follicular lymphoma, CLL, follicular and marginal zone lymphoma. CLL देखो, all these are B cell, तो all of them are 19 positive. CLL along with 19 is 5 and 23 positive. 19 positive, 5 positive, 23 positive. Follicular 10 positive होता है, 5 negative, 10 positive versus marginal. He is the poor guy which always passed on the margin, so it is 5 negative, 10 negative. So CLL 19 positive तो था ही, 5 positive, 23 positive. That is the case of CLL. That is CLL. Next question. Next one. A young child presented to OPD with history of ingestion of paint chips and soil. Peripheral smear examination is performed. Look at this peripheral smear. Girls, you will be able to identify the abnormality much better in this. Identify the abnormal RBCs. These are the RBCs with basophilic stippling, blue dots which are present on the RBC, basophilic stippling. The most common cause of which is lead poisoning. Basophilic stippling, that is, it is associated with lead poisoning. Simple. Plus history of paint chips भी था. इसमें अगर नहीं भी paint chips की history दी होती, then also the image itself was diagnostic in nature. That is lead poisoning, basophilic stippling. Next question. Next question. You had a history of a young female presenting to OPD with lower abdominal discomfort. So whenever history of young female with abdominal discomfort, मतलब ovaries की बात हो रही है, post surgical lesion shows hair and teeth. Again, please do tell me in the comment section whether gross image of ovary with hair and teeth extruding out was given, yeah, was it written as a MCQ. But the minute we have ovarian lesion with hair and teeth extruding out, it makes it as a teratoma, dermoid cyst or mature cystic teratoma, also called as dermoid cyst. This is the most common germ cell tumor of the ovary in young females, that is dermoid cyst or teratoma. It has all three layers, ectoderm, mesoderm, endoderm. So hair, teeth and cheesy material extrude out. Lastly, last question. I do not have the exact options of this, but not even needed क्योंकि fixatives usually पूछा जाता है. Fixative for pap smear. Guys, alcohol pap smear. कितना % alcohol? We use 95% ethyl alcohol. 95% ethyl alcohol pap smear. So I'm again saying this, which is overall the most commonly used fixative in pathology? Formaldehyde. So other options can be 10% formaldehyde. This is overall the most commonly used fixative in pathology, versus for electron microscopy, in which we use glutaraldehyde. Glutaraldehyde. So these are the 3 points that we need to know with respect to fixatives. Recent FMG PYQ was cost effective method for screening cervical cancer. VIA, visual inspection with acetic acid. So similar topics are repeated in pathology, firstly. Secondly, the crash course, 2-hour crash course, from which we had 12 to 13 questions of path. So on this note, we wrap up our this recall session. But needless to say, bestest of luck for the result. I love you enough to say I never want to see you again in an FMG class. We'll be doing the PG sessions together. There's absolutely no doubt about it. But अब की बार में अच्छे सा result आए, we all of us may pass, and हम लोग अच्छे से pass होके we clear this stupid paper and get it over with. So on this positive note, thank you and take care.